I'm Musandiwa and I'm a first-year medical student at Stellenbosch. My colleagues and I will be examining your respiratory system, so I'll be doing your vital signs. Can you please take a seat, sir? Okay. Can you please stick out your tongue for me? To the left, please. To the right, again, and up. So, you don't seem to have any signs of central cyanosis, and I see you're not using your accessory muscles. You don't have any wheezing sound, so you don't have any respiratory distress. So, okay. Where are you from, sir?
Johannesburg.
Oh, you're from Johannesburg.
Yes.
Are you studying?
Yes, I am.
What are you studying?
Medicine. So.
Okay, so I heard you have an OSCE in a few weeks.
I do. I'm very stressed about it.
Okay, just have to study.
Hopefully I can get through it.
Okay, I was just assessing your pass rate.
Okay.
And you have 80 beats per minute.
Thank you very much.
Okay, and I see you have a normal breathing rate, which is about 16 beats per minute. So you are healthy.
Thank you.
Hey, I'm a student out there. I would like to do some procedures with you. Please stick out your palms, your arms out in front of me. Arms. Okay. Just observe so you get in stage.
Good afternoon, sir. I'm Yohali, Hatungimana, first-year medical student. I'm here to examine your trachea. May I proceed to touch you?
Yes, you may.
Okay, thank you, sir. So can you please turn your head to the left knee slightly? Thank you. Just make sure the muscle clearly visible. Can you please turn to the right for me? Thank you. Beautiful. Can you please return your head to the neutral position? Thank you. I'm just going to check your tracheal rings now. Right. Everything seems to be in order, so that's it. Thank you very much.
Hello, sir. I'm Snago. I'm going to do examination on you about Jaccol. So I'm going to start examination about jaundice, which is a liver condition that is characterized by high bilirubin levels. So the patient with jaundice show with the yellow coloring of the skin, and also by yellow pigmentation of the skin in the hands, or also in the skin, and also by the color of the eye, of which on you it is normal. And also we move forward to anemia, which is insufficient number of red blood cells in the body. So we see anemia by looking in the nails of the patient if they are more pale or not, of which your hands they are fine. Or also we look on the conjunctiva of the eye, of which yours they are also normal, they are not more pale. Then we go forward for clubbing, which is I want you to do like this, so that if there's diamond shape, which means you are fine, don't have, you are not clubbed. But then if we don't see that diamond shape, it means we are clubbed. So maybe please do it like this. And we call that angle a hypernical angle, of which you do have that angle, which means you are not clubbed. Thank you, sir.
Good day, I'm Anja and I'm a first-year medical student. I'm going to further do your general examination. Is it alright if I proceed?
Yes.
Okay, so first I'm going to look for cyanosis, so that's a blue discoloration in your skin and membranes. So first I'm going to look at the tips of your fingers and also at your toes for peripheral cyanosis. And then I'm going to look at your tongue, so preferably or specifically at the tip, the sides and the other surface for central cyanosis. So can you please open your mouth and lift up your tongue? I see no blue discoloration, so that means you don't present with cyanosis. Okay, so next I will be checking to see if you present with edema, which is the presence of excessive fluid. So I'm going to apply moderate pressure over the distal part of your tibia, and also over the dorsal of your foot. And next, I'm going to have to look at your sacrum. I have to apply pressure over your sacrum for 10 seconds. So can you please sit up with me? So So I'm going to apply pressure for 10 seconds over your sacrum, just to palpate for possible edema. Opening of the skin in your lower limbs or near your sacrum, so you don't present with edema or sacral edema. Checking your lymph nodes, it seems to be fine, your lymph nodes are not enlarged. Thank you so much for your cooperation.
Hello sir, I'm Destinee Bombil. I'm a student at Stellenbosch University and I'm studying medicine. I'm going to be doing the first part of your chest inspection. Am I allowed to do that?
Yes, you may.
Okay, so for the first thing, I'm just going to assess your chest. I'm just going to look for anything that is abnormal, any scars or any lesions, because that could be, needing investigation. I'm also just going to assess if you have any abnormal shaping of your chest, because that could obstruct your airways. And I'm just going to assess from the front of you. I just need you to sit upright for me. I just want to assess the proportionality of your back and of your front to ensure that everything's in a normal shape and there's no deformities. Thank you so much. You can lie back down.
My name is Safea and I'll be doing the second part of your inspection. Do I have your consent to perform this examination?
As I introduced myself, I noticed that the depth of breathing is normal and his chest movements were symmetrical. If we look at the breathing pattern, it was also regular and the respiration was normal, as the patient is not breathing abnormally deeply or at an irregular pace.
Okay, I'll be standing on the right hand side of the patient to examine the middle lobe expansion of his chest. Okay, so there's symmetrical movement and there's equal rise and fall of the left and right side of his lungs. And then I'll be standing behind him to assess the upper lobe expansion. Can you please take a deep breath through your mouth? Thank you. Okay, so his clavicles are moving equally up and down. So there's symmetry. And then lastly, I'll be standing at his feet to examine the lower lobe expansion. Can you take another deep breath for me? Okay, so there's also equal movement up and down on both sides of his chest, so there's symmetry. Thank you.
The respiratory movements are also symmetrical anteriorly and posteriorly, which is an indication that there's no loss of function at either of the lungs. If we look at the middle lobe expansion, the rhythm was still regular. Going to the upper lobe expansion, the chest movement was symmetrical. However, if the movement had been diminished on either side, it would suggest an underlying pathology.
Good day, sir. My name is Cleo. I'm a first year medical student at the University of Stellenbosch. I will be doing the palpation of your chest. Do I have your consent? So first of all, we're going to assess your chest expansion. So I'm just going to place my hands on your chest and I'm going to ask you to take a deep breath for me, please.
Respiratory movements and chest expansion are assessed anteriorly by placing the hands over the lateral aspect of the anterior chest, with both thumbs aligned just below the xiphisternum. Normal chest expansion ranges from 5 to 8 centimeters. This also needs to be assessed posteriorly.
And now I'm going to need to do that again but posteriorly, so I need you to sit up for me, please. And take another deep breath. Thank you. You can lie back down. And now I'm going to be assessing vocal fremetus.
Vocal fremetus is a feeling of palpable vibrations transmitted from the bronchopulmonary system to the chest wall when the patient talks. One uses the palm of one hand on each side of the chest to palpate symmetrically. This is to see if the fremetus is symmetrical and identify areas of increased fremetus. Implications include a solid medium of lung tissue which conducts vibrations better than air and therefore fremetus increases with consolidation of the lung. Normal findings on palpation include normal skin temperature, no masses, no signs of respiratory distress. There should be no tenderness during palpation. Chest expansion should also be symmetrical and normal, and there should be no increased vocal fremetus.
So I'm going to place my palms on your chest and then I need you to say the words 99 for me.
99,
99,
99,
99.
99.
And then please sit up one more time so I can do it at the back. Can you please hug yourself for me? Thank you.
99,
99,
99,
99.
99.
Okay, thank you.
Hi, my name's Marina Ackermann. I'm a first-year medical student. I'm just going to tap on your chest a little bit to hear how your lungs work. Is that all right with you?
Yes, that's okay.
Great.
The important anterior landmarks for percussion are the right and left supraclavicular fossa, the angle of Louis, the right and left midclavicular line, and you will be percussing from the 2nd to the 6th intercostal space.
So first I'm going to go at the supraclavicular fossa.
When percussing the chest wall, the resonance of the underlying tissue can be determined. This is done by percussing on equal but opposite sides of the chest. Resonance should be heard over the lungs, which indicate that they are air-filled. Hyperresonance would indicate a hollow structure. Dull sound to percussion indicates consolidation, which is normal over the liver on the right and over the heart on the left side. Stony, dull sounds would indicate a fluid-filled space.
The axillary regions are percussed anteriorly, and the left side is compared to the right. Posteriorly, the patient is also percussed downwards, and the left and right percussions are compared to each other, as well as the axillary regions from the posterior angle.
And I'm a first-year medical student, and I'm going to auscultate your chest to listen for your breath sounds. Is that okay with you?
Yes, it is.
I need to take a deep breath in.
The patient is asked to breathe through his mouth, and breath sounds will be compared for the left and right side, as well as anteriorly and posteriorly.
In and out. Okay, now I'm going to listen to your second intercostal space. Breathe in and out. And in and out. Again. And out. In and out again. Another deep breath. And out. And breath in and out.
Added sounds such as a wheeze or a pleural rub will also be noted.
And breathe in and out.
Normal vesicular breathing is soft, low-pitched sounds which are louder and longer on inspiration than on expiration. There is no gap between inspiratory and expiratory sounds. Bronchial breath sounds are hollow and are found in areas of consolidation. Amphoric breath sounds are exaggerated and hollow and are found in lung cavities. The intensity of breath sounds is about the entry of air into the lung and can be normal or abnormal. Abnormal sounds can be reduced or absent, and this can be due to limitation of airflow. These limitations are emphysema, pleural effusion, pneumothorax, or a collapsed lung.
When listening for vocal resonance, we are listening on each side, comparing left and right as well as anterior and posterior, while the patient says 99. Over a consolidated lung, speech will be clearly audible, while it will be muffled over normal lung tissue.
For full respiratory examination, we have concluded that you are fully healthy.